My name is Kristie Lancaster. I'm the Lifestyle Chair of the Epi Lifestyle Conference, and I am here with Dr. Matthew Gillman and Dr. Rebecca Gottesman, who are our keynote speakers this morning at our opening session focused on cardiovascular health through the lifespan. And I would like to ask you, what are your key messages from your talks?
Thanks very much, Kristie. Matt Gillman. I am a physician epidemiologist, and I direct the Environmental Influences on Child Health Outcomes, or ECHO program at NIH. The key messages from this morning are that in recent years, we've put more emphasis on cardiovascular health as well as cardiovascular disease. And we know that if people get to age 45 or 50 with optimum cardiovascular risk factors, their lifetime risk of heart disease, stroke, is very, very low. The problem is that only a very small proportion of the people actually get there. And why is that? A lot of it is that this starts earlier in life. So we know that fewer than half of adolescents actually have 5 of the 7 Life Simple 7 cardiovascular health metrics. And if we go back even further than that, we know from this paradigm of developmental origins of health and disease that these health trajectories start even before birth, when development is so plastic and things are happening and organs and systems are developing. So the idea is, what can we do at these very earliest stages of human development so that we can get kids on the right trajectories so that they wind up with a lifetime of cardiovascular health? One of the key issues is childhood obesity and interrupting intergenerational cycles that keep obesity going in our population. The issue there is that a lot of our studies are not big enough or not rigorous enough to show what these modifiable risk factors are. So we need more studies with bigger sample sizes, with more diversity, whether that's geographic or racial, ethnic, or socioeconomic status, to show us these relationships between potentially modifiable solution-oriented exposures and cardiovascular health outcomes. In addition, we might look even beyond ideal cardiovascular health towards something we call positive health, which is about the assets that lead to well-being, well-being consisting of happiness and life satisfaction and global health and things like that. Because our studies in childhood could use this child-centric outcome, which cuts across disease silos and is more than just the absence of disease, so that we can measure something that's very salient in childhood. Finally, the ECHO program itself, which consists of intervention studies and 72 cohorts which we're putting together into one platform, could be a real contributor to this kind of research going forward. Ultimately, we want to know what kind of research will have an impact on policies, programs, and practices. And we aim to work with those people who are putting research into action so that we know what the best research questions are. And with those advances, I think we'll be in good stead to have every baby who was born with the potential for ideal cardiovascular health to try to reach that potential.
Dr. Gottesman?
Sure. I'm Rebecca Gottesman. I'm a stroke neurologist and epidemiologist at Johns Hopkins. And what I focused on in my talk today was the role of vascular health in midlife, and perhaps even earlier, and its importance in brain health. So we know that there's a lot of overlap between vascular types of dementia and Alzheimer's dementia. So many people who are diagnosed with one actually also have the other when they do autopsy studies. And lots of these vascular risk factors, the same things that are risks for stroke and heart disease, are really important in predicting cognitive decline in dementia. So high blood pressure, diabetes, etc., are really important, especially in middle age. So these are important because these are modifiable risk factors, and currently we don't have any other way to treat or prevent Alzheimer's disease. So we focus on midlife because this is a time window when we may actually be able to make an impact on cognitive outcomes, on cognitive decline in dementia. But it turns out that most trials that have attempted to treat these vascular risk factors have generally not been successful in actually reducing dementia or improving cognitive decline. So there's one trial, the SPRINT-MIND trial, did show some benefits in mild cognitive impairment risk and a combination of MCI and dementia risk for people that were more aggressively treated with blood pressure targets that were below 120 systolic. But other trials have been unsuccessful in other areas of vascular risk. So I think we need to think about controlling vascular risk as one part of promoting brain health, but not the only part. So in addition to reducing risk, we need to think about things that promote our ability to age from a brain standpoint in a healthy way. So cognitive reserve is one of those things that we talked about this morning. So cognitive reserve is the concept that you can have pathology in your brain, but that you do very well cognitively despite that. So you might have changes that look like Alzheimer's, changes that look like stroke-like changes in the brain, but your cognitive function is very preserved despite that. Things that generally lead to cognitive reserve, education is the most classic example, but there's probably other things that also promote cognitive reserve, promote your ability to function well despite not having good pathology in your brain. In addition, health promoting lifestyle factors such as exercise, physical activity, and diet are probably really important for helping promote good physical health as well as good brain health. So really the focus on the talk was let's think about not just reducing these risk factors, but also promoting brain health through promoting cognitive reserve, thinking of what might be important ways to promote cognitive reserve in different populations, and also promote these positive physical activity and lifestyle behaviors.
What do you see as some future research that can help us to learn more about your areas?
So it's a really exciting time for looking at developmental origins of cardiovascular and overall health. I think we've recognized for some years that in these early plastic periods of development, organs and systems are developing and they set down trajectories for a lifetime. So understanding those trajectories, understanding the developmental periods, understanding critical periods where insults or perturbations might have lifelong, sometimes even irreversible consequences is really important. And it's important to do that both in observational and intervention research. In observational research, we really need to have large sample sizes. We need to have diversity of our populations. And we need really rigorous approaches where we're looking not only at p-values but effect sizes. We're really trying our best through clever study designs to take advantage of, to take account of confounding and bias. In our intervention studies, we need to focus on those things that the observational studies are targeting as modifiable factors so that we can really do the best for preventing disease and promoting health. And we need to take a look at the entire social ecological ladder. So we're focusing not only on individual behaviors, but the policy and environmental levers that actually have an impact on those behaviors and may embed themselves in physiology irrespective of them.
And I think to learn more about promoting brain health, in many ways, we might need to link more with these pediatric studies. So really understanding what happens early to promote cardiovascular health in middle age, but then what goes on to really promote brain health. And I think we have really good studies at younger ages and really good studies at older ages, but if there's a way to really bridge the gap, I think that might help us learn a lot more about brain aging and brain health in general. In addition, we don't know that much about what truly leads to this concept of cognitive reserve. And most importantly, there's populations who, for a variety of reasons, don't get the opportunities and exposures in childhood. So less privileged populations who might not get as much education or as high quality education. We need to figure out ways to promote cognitive reserve even if they don't have those opportunities when they're very young. Certainly getting those opportunities out there is one goal, but we need to think about ways we can help people even throughout the life course.
Great. And just one last question. Is there anything that you would think clinicians should take away from this as they think about their practice?
One thing that clinicians can take away right now is that when babies are born small and they gain weight through a surfeit of energy and lack of physical activity and things like that they're faced with, that's the kind of baby that has the highest risk of cardiovascular disease later in life. So pediatricians, family doctors, neonatologists who are taking care of newborns who are small for gestational age should monitor growth carefully and not overfeed them so that they gain weight prematurely.
And for clinicians who are taking care of adult patients and thinking about how to have best brain health, lots of patients tend to ignore vascular risk factors. They might watch their blood pressure for a while or watch their high cholesterol or not even go to the doctor. But I think people are pretty terrified of bad cognitive outcomes and dementia. And in my experience, if you tell people if you control these risk factors, you might have a chance of reducing your risk of dementia, they absolutely take that as a reason to control those risk factors. So as a clinician who's taking care of those patients, making sure that they're following their blood pressure, that they're watching these risk factors, in addition to promoting the positive activities, is going to be really important for hopefully reducing the burden of dementia and cognitive decline in future years.
Thank you so much for taking the time to present in our opening meeting today. It was a great way to launch our meeting with this theme of promoting cardiovascular health through the lifespan.
Thank you.